We will discuss the ceramic restorations. The first attempt to use the ceramic was by a French pharmacist and a French dentist in the 1774. More than 100 years later, there was made the first ceramic crowns and inlays using the cast powder furnace technique in the 1887. It was fought by the number of risks, so it did not get popular until the electric furnaces were introduced after a couple of years. In 1962, the ad of the Lucette porcelain made the metal ceramic restorations applicable. The presence of the Lucette and the aluminum silicate with high thermal expansion allowed the matching between the thermal expansion of the ceramic and the metal. After the introduction of the vacuum firing, the porosity of the ceramic was reduced and we got a more denser, stronger and more translucent results. We will start the ceramics talking about the zirconia. The monolithic restorations provide a good compromise of outstanding strength and aesthetics that are acceptable for the posterior restorations. To increase the aesthetic of the monolithic zirconia, the use of a multi-layered zirconia can be a solution. Zirconia is usually made from a pre-sintered blocks, which means that the material is compressed and heated where the atoms are close to each other before reaching the melting point, and if the soft milling is for the pre-sintered, which is the most common, and the hard milling is for the sintered zirconia, but it requires the equipment to be more rigid, so there must some micro cracks happen in the zirconia core when we are doing the manufacturing, which will decrease the physical and mechanical properties of the zirconia. So the soft milling is the common way to manufacture the zirconia. We must compensate for the 25% of shrinkage that happens during the manufacturing, so we must increase the shape, the size of the restoration. Also, to increase the aesthetic of the zirconia, we can add the feldsparic layer of porcelain, which is highly aesthetic. However, it may be subjected to cracks or breakage that can be fixed by replacing the whole crown or doing a repair using composite resins, or just polish the broken side. To increase the stability of the zirconia, the addition of an oxide, which is the yttrium oxide, is made. This combination is the most common one, and that the cores of zirconia are made of. Also, implants, zirconia implants are made of this material, whole crowns and bridges, whether they are anterior or posteriors. Also, the abutments of the implants, when we are using them as zirconia, they are made of this material. Oxide and zirconium oxide and yttrium oxide. There are blocks of zirconium reinforced lithium silicate ceramic that is made up of lithium silicate, disilicate, and zirconium oxide. So we combine the aesthetics from the glass base and the mechanic properties from the additives, which are the lithium disilicate and the zirconium oxide, so they can be used as bridges of and crowns. They are made by heat pressing or CAD-CAM technology. We know that the ceramic composition is made up of some metallic oxide, which is the silicium oxide, which is the feldsparic and the quartz, in addition to kaolin, that is with addition also to metallic pigments like the zirconium oxide and the titanium oxide. This composition is highly aesthetic, but as we said, it is fragile. So to increase in its mechanical properties, we added some materials. The first one we added to it was the lucite. The lucite reinforced glass ceramic was named as an IPS impress, but it is only used for the anterior part of the mouth because it is not so mechanically applicable in the posterior part of the mouth. So the addition of lithium disilicate to the base, the ceramic base, has increased the strength, and we got the material that is called Impress 2. When the percentage of the lithium disilicate has increased to be 70% of the glass matrix, it is now called the IPS Emax ceramic material, and now it can be used for the anterior crowns, posterior crowns, inlays, and veneers. Now let's see the mechanic manufacturing. As we said before, the zirconia is made only in soft milling, but other types of ceramics are fully sintered, and they are made by hard milling. Although they are made now using the CAD-CAM and the heat press technique, in some cases when we need so much thin veneers or onlays, the traditional way of casting the dies and doweling them, then trimming them, then doing the normal layer by layer building of the ceramic and sintering them until we get the final results after the polishing and the glazing is commonly used as well. The connectors between the metal is so minimum in comparison to the ceramics, and only zirconia requires the smallest connectors. So the ceramics are considered more bulkier. For the bonding, the types of the ceramics generally can be bonded to the resin cements, and they are reinforced by this bonding. But the zirconia cannot be etched by the hydrofluoric acid. So a material that is called the 10MdB as a monomer primer has increased the bonding outcome of the zirconia. So the first step is that we etch the ceramic crown or bridge with an hydrofluoric acid with 10% concentration. The duration depends on the ceramic material. For the feldsparic, we etch for 5 minutes, and we rinse really well under the running water. Make sure that it does not get contact with the skin or eyes. Also, we can use phosphoric acid for 15 seconds to ensure that no residual of the hydrofluoric acid is present. Then we dry the crown and add saline. Saline is a silicon compound, hydrogen compound, and monomeric compound that is used as a coupling agent to bond inorganic material to organic resins. So we apply it for 5 minutes, and we can increase its effectiveness by adding heat to it using the light cure. After that, we add the bond layer, but we do not cure it. For the teeth, we do normal dentin enamel etching using the phosphoric acid. Then we do two bonding layers without lighting it. Then we add the light resin cement, and we put the crown on the tooth. We do 3 seconds of cure, and we remove any residual of the resin cement, and then we continue curing until it is all full set. There is a concept about inlays and onlays that they provide durable alternative to posterior composite resins without the extensive tooth preparation needed for crowns. So take these in perspective when you want to do any restoration in the posterior area of the mouth. Thank you very much. Salam.